Hey everyone, so you're getting ready for your nursing fundamentals class, probably digging into chapters 43 and 48, right? Well, you are in exactly the right place. We're about to do a quick review of the must-know vocabulary for two super important areas of patient care, sleep and wounds. Let's get right into it.
And I ask that because, really, that's what this is. This isn't just about memorizing words for a test. It's about learning to speak a whole new language.
You know, every single term we go over today is a tool in your toolkit. It's how you're going to understand what's actually happening with your patient, how you'll assess them properly, and how you'll communicate with the rest of the healthcare team. So yeah, let's get fluent.
Okay, first up, we're starting with something we all think we know about, sleep. But in nursing, you gotta understand it on a much, much deeper level. So let's break down the language of sleep.
So think of the circadian rhythm as your body's own internal master clock. It's the thing that's constantly telling you, hey, it's getting dark, maybe you should feel sleepy. Or, sun's coming up, time to get some energy. Now when this clock gets all messed up, say from an illness or just being in the hospital, it can seriously impact a patient's ability to recover.
You see, sleep isn't just one big block of time. A huge piece of it is what we call NREM sleep. The easiest way to think about this is as the body recharging phase. This is when all the heavy lifting happens for physical repair, healing tissues, building bone and muscle. NREM is all about physical restoration.
And then you've got the other major player, REM sleep. Now, if NREM is for the body, well, REM is for the brain. This is the brain recharging phase. It's when we dream. It's when we process everything from the day, and it's when we lock in memories. It is absolutely crucial for learning and just plain thinking straight.
And this slide just lays it out perfectly, doesn't it? On one side, you've got NRM for physical repair and deep sleep. On the other, you have REM for mental restoration and dreaming. They're totally different, but both are 100% essential for a healthy sleep cycle. Our patients need both to truly heal.
So what happens when sleep goes off the rails? Let's talk about the common disorders and the interventions you'll need to know as a nurse.
You are going to see these three a lot. Insomnia is the one we all hear about. Just can't fall asleep or stay asleep. Then there's sleep apnea, which is really serious. It's when a person literally stops breathing for short periods while they're asleep. And narcolepsy, which is that overwhelming daytime sleepiness and sudden uncontrollable urges to sleep. Each one is a different puzzle to solve.
Now, one of the most powerful tools you have is teaching good sleep hygiene. And that's just the clinical way of saying healthy sleep habits. You know, things like keeping a regular schedule, making the room dark and quiet, and avoiding caffeine at night. This is a core nursing intervention, and it can make a huge difference.
All right, let's switch gears. We've talked about how the body restores itself from the inside with sleep. Now let's talk about how it restores itself from the outside by learning the language of wounds.
Okay, so generally, wounds heal in one of two ways. Primary intention is the ideal scenario. Think of a clean surgical cut, where the edges can be neatly stitched or stapled back together. It heals fast with just a tiny scar. But then there's secondary intention. This is when a wound is left open, maybe because of a bad pressure injury. It has to heal from the bottom up, which takes way longer and leaves a much bigger scar.
And the healing process itself has its own vocabulary. First things first, hemostasis. That just means stopping the bleeding. Then comes granulation. You know that pink, kind of bumpy-looking tissue you see in a healing wound? That is granulation tissue, and it's actually a fantastic sign that the wound is rebuilding. And finally, epithelialization happens, where new skin cells basically march across the surface to seal it all up.
As a nurse, you're going to be the eyes on these wounds, so let's learn the key terms for reading the signs, both the good signs and the bad ones.
First up, exudate. It's the official clinical term for any kind of fluid or drainage coming from a wound. But here's the thing, you can't just document exudate and call it a day. You have to describe what it looks like, which leads us perfectly to our next slide.
This table right here is your cheat sheet. Serous fluid is clear and watery, totally normal. Sanguineous is bright red blood. Serosanguineous is a pale, pinky mix of the two. But the one you have to burn into your brain is purulent. If you see thick, nasty, colored drainage, yellow, green, brown, that is a huge red flag screaming infection. Now for two words that sound similar and get mixed up all the time, but they are critically different. Dehiscence is bad, no doubt. It's when a wound that was sewn shut starts to pull apart. But evisceration is a full-blown catastrophe. That's when the wound bursts open and internal organs actually start coming out.
I'm going to pause here because this is so important. Evisceration is an absolute drop-everything surgical emergency. Knowing how to react in that moment is something you absolutely have to know.
And finally, let's talk about preventing problems before they start. When you press on a red spot on someone's skin, it should turn white for a second and then go back to red. We call that blanching. If you press on it and it stays red, that's non-blanchable erythema. It's a warning sign that tissue damage is already happening under the skin, and it is the key indicator of a stage 1 pressure injury.
Okay, so we've done a deep dive on sleep and a deep dive on wounds. You might be thinking they're two totally separate things, but in nursing, nothing is separate. It's all connected.
This is the big takeaway I want you to leave with. Remember how we said NREM sleep is for physical repair? Well, it's during that deep sleep that the body releases critical growth hormones that are essential for rebuilding tissue. So if your patient isn't getting that deep restorative sleep, their wound is going to heal much more slowly. Your assessment of their sleep is directly tied to their wound healing.
And really, that's what this all boils down to. Learning this vocabulary isn't just about sounding smart. It gives you the tools to be a better observer, a better communicator, and at the end of the day, a better nurse.
So as you head into class or get ready for clinicals, I'll leave you with this question to think about. Now that you have the words, what stories are you going to be able to read? What are your patients' sleep patterns and their wounds going to tell you? Good luck out there.